Mississippi.org. And today we're going to learn more about the Child Health Development Project, Mississippi Thrive. It's a multi-year partnership between MSU's Social Science Research Center and the University of Mississippi Medical Center. And joining us today to share a little bit more is Lauren Elliott. She's a nurse practitioner with UMMC, and Dr. Heather Hanna. She's an assistant research professor at Social Science Research Center at MSU. It's a mouthful, but it's going to be a good thing. So I'm going to start with Heather. Tell us a little bit more about the Child Health Development Project. This sounds like such a good project to help Mississippi thrive.
Hi, Rebecca. Thank you so much for having us on. The Mississippi Thrive Project has been a 5-year partnership between the University of Mississippi Medical Center, also known as UMMC, and the Social Science Research Center at Mississippi State, also known as the SSRC. And it's been funded by the Health Resources and Services Administration with the goal of improving the early childhood developmental health system in Mississippi. And that sounds like a lot of words, but what it really means is making sure children and families receive the services they need to promote developmental health. And what we really mean by developmental health is making sure that children are exhibiting the attributes and skills that are expected for their age.
Now, Heather, if people are catching on to this on Good Things, that's Ole Miss and Mississippi State coming together for this great partnership, obviously through UMMC and then the Science Center there. So how did you guys come together to make this happen?
So you're breaking up a little bit on me, but I believe you're asking about how we came together.
Yeah.
We had conducted a study together in 2014 looking at developmental and behavioral health in Mississippi and realized there was just a lot of work that needed to be done. And so naturally this study was a next step for us to try to do something about what we found.
Now, Lauren, I know that this is really to help parents or practitioners to better understand what's happening between that 0 to 5 year. It's such a critical age that I don't think and we're trying to survive, right? We get them home from the hospital and then we're just trying to get them through those first couple of years and keep them alive. But there's some major developments that are happening during those first 5 years. What should parents be concerned about?
Exactly right. So the main thing that happens is the brain development. So you may not know that a child's brain actually grows most rapidly in the first 5 years, and by the time that the child is 3, their brain is already 80% of the adult size. This leads to the brain development leads to skills that help us plan and focus attention later in life. Give us the ability to juggle multiple tasks. We obviously look at development and social, emotional, like relational health too.
I'm sitting here writing all of this down, Lauren, because I have a 2-year-old and I have 1 year left to get her to 80% of her adult brain. Her adult brain. I can do it. Yes, I know they pick on me. My family does because I used to work with preschool children and understood at least cognitive and functional skills working together. And I think it's like by the age of 5, if you haven't learned to just jump with your feet together, it's tremendous. It's harder to learn that later in life. You can jump, but having the 2 feet together when you do it, it makes it tougher if you weren't taught that before 5. So I had my kids jumping as soon as they possibly could put 2 feet together. I get picked on all the time about that. But let's talk about what you guys are actually screening for. What's getting screened in Mississippi Thrive?
Okay, so physical development, things like for babies, rolling over, then eventually walking as they get older, running, jumping, skipping. That's the gross motor. Then the fine motor would be picking up small items, feeding themselves, and then when they get older, writing. So physical development is the first thing. Then communication, so that's speech and language. So we want to know, are people able to understand what the child is saying? By the time they're 3 or 4, how is their language developing? Then personal social skills are super important. That's something like interaction with others. An example is playing peekaboo or pat a cake, feeding themselves, playing with other children. And as they get older, we want to know if they're playing alongside other children or with other children, like in tag or, those kind of games. And then problem solving. So we want to know if a young child is looking for a purposely hidden object, like in a game that you're playing, indicating that they realize the item is still in existence, although it's out of their sight. So just making sure that cognitive development is coming along like we want it to.
That feels like a lot, Lauren, a lot for parents to take in or for your health provider to do. So how are these screenings being implemented? I mean, is it a checklist? Is it physical? Is it a combination?
Yeah, it is a combination. So the main thing that's occurring is in the healthcare setting, like at a pediatrician's office or a family physician's office, parents are filling out questionnaires, and these are well-studied and well-researched questionnaires on what children should be doing at certain ages. So the parent has the opportunity to ask the child in that moment, hey, would you hop on one foot? Or, can you write the letter K, or, whatever it is. So they have the opportunity to do that in the moment. This is often done also in child care centers, so like in a daycare setting. So medical providers and child care providers can utilize these parent-reported questionnaires to make sure that these kids are on track.
Now, Heather, this really is a team approach, and I think your phone kind of cracked up on you earlier, but I said if you're, for us Good Things listeners, we don't need to miss the part that this is Ole Miss and Mississippi State coming together, or UMMC, right, and MSU. And so how is each partner contributing to the overall program?
Yeah, so it really has been a joint effort on all fronts. We've each lent our own respective talents to move the project forward. One of the things that we focused on is parent knowledge about developmental health, and we've tried to tackle that a couple of ways. One is implementing the Reach Out and Read program in some pediatric medical homes across the state, and then also trying to really integrate the Vroom program across the state as well. And both of these programs are designed to help parents learn how to foster their child's development through daily interactions. But whereas the Reach Out and Read program works through the medical home, Vroom is an app that parents can download, and that's VROOM. So you just go and download the app, and it gives you tips daily. But really, the bulk of our work has focused on improving the developmental and behavioral health workforce, just to really make sure that professionals interacting with young children and families are aware of and using those best practices that Lauren's talking about. And so to this end, we've worked with state agencies to really try to embed developmental health information into child care and home visiting staff trainings, and also worked with the healthcare workforce, which Lauren can tell you a little bit more about because it's been primarily UMMC-led.
And I know you've had a shift from maybe a regional model to more of the state level, Heather. What does that kind of look like? Is that just getting it to the broader people in terms of training? Or maybe Lauren can answer that with us. I know that, it went from sort of a regional mindset to more of a state level. Is that just making sure that all the people who have access to kids in early learning have access to this training?
Yes, I'll speak up since we can't hear Heather, but absolutely, we want to reach anybody and everybody in the state who touches children in any sector, education, health, child care, and we have worked with state entities to embed these models. So if anybody has questions, we really would love for you to connect with us, and we're working to build systems in the state to support early child development, really no matter what.
And I know you've got great resources. You'll have a great website and up with a lot of information there. So where can folks go?
Yes, please join us on social media, but you can visit our website, MississippiThrive.com. So you'll spell out the word Mississippi, otherwise you will not end up at our website. So MississippiThrive.com, and that'll link you to all of our social media accounts. We have Twitter, Facebook, and tweet things often regarding child brain development.
Well, I love it. I love that the two universities have come together in their own respect to sort of have this program. They're both shining bright for Mississippi, and I think a lot of good will come out of it. So thank you, Lauren.
Thank you so much for having us.
All righty. And I think Miss Heather is Miss Heather, are you still with us?
I'm trying. You've been breaking up the whole time, so I get a little bit of what's being said. But yes, I heard my name. So thank you so much for having us.
No, you did. The good news is, Miss Heather, you're coming through loud and clear for us, and we appreciate all the work that you are doing and taking the time